Welcome back to 41 Today Lifestyle, everyone. I'm over here with Dr. Stevenson from Optim Neurosurgery. Welcome to the show, my friend.
Thank you, sir.
Nice to see you again. I want to talk to you a little bit about why would be some of the reasons I would be seeing a neurosurgeon.
Primarily back and neck pain, even though we're trained to do brain surgery and peripheral nerve surgery. The bulk of what a neurosurgeon sees is back and neck pain, and it's actually the second most common complaint that people go see their primary care doctor for. Is back and neck pain is number 2 after cold and flu symptoms.
Really?
Really.
Huh. But when you see these patients, do they have back and neck pain, or is it something that's, triggered by something else?
It can be, a weekend warrior muscle strain.
Yep.
It can be arthritis. It can be a fracture. It can be a tumor. It's a number of different things cause neck and back pain. Probably the most common, though, is just garden variety arthritis.
Oh, really?
Really.
Well, it's interesting you say that, because just recently I went to a chiropractor because my neck was sore. I love going to chiropractors.
Sure.
I don't know why, but I just think it sort of gets the joints going again, right?
Sure, yeah.
Well, how do you feel? Because when he manipulated my neck, I actually felt stress go from my shoulders.
Sure.
Like, do you know what I mean by stress? Like that pressure.
Right, right. So the muscles of the body respond to underlying bony conditions. So if you have arthritis or a strain in your neck, the muscles are going to respond by spasming some. So, the fact that you're treating the underlying problem, the muscle can then relax.
Okay. Now, you've talked before about body mechanics.
Sure.
Well, explain to everyone at home what you mean by that.
Okay, so your mother was right when she told you to sit up straight.
Yes.
There's a reason for that. Also, lifting. You're supposed to lift with your legs, not with your back. So there are a lot of little body mechanic things. Or if you have an office job and you are sitting staring at a computer screen all day, you need to adjust. You need to move. You can't have your neck just staring in one position all day long, or it's going to bother you.
Well, and that's one of the things, like, these Apple Watches. They tell you to get up and move if you've been sitting down too long. What do you feel about the chiropractors and coming to you for similar pain? Do you work hand in hand? Or you said your patients go to GPs first?
Typically so, but yes, I have a number of patients who see a chiropractor as well as myself, and I have a good relationship with a number of chiropractors here in town who will oftentimes send me a patient and say, hey, make sure there isn't something scary going on here. And then I send them back to the chiropractor if that type of treatment is effective. I'm all for it.
I love that. I really appreciate you saying that, because I'm a believer in working both.
Sure.
Okay, now let's talk a little bit about spine health.
Okay.
What can people do at home to have spine health?
Okay, there are a couple things you shouldn't do, okay? So, being overweight. For every 1 pound you are overweight, your back sees 4 extra pounds, okay?
Really?
Shifts the center of gravity. Smoking is one of the worst things you can do for your spine. The discs, which are like the shock absorbers between the vertebrae, they have no blood supply. And if you smoke, you can injure the disc cells just because they're not getting the oxygen that they need. Also, again, proper body mechanics, doing things like yoga and Pilates. There's a number of things you can do to avoid having to come see me.
You said weight loss for the spine. Explain that a little bit about for me.
Okay, so if you are overweight, that puts a lot more stress on the spine. It puts more stress on every joint in the body, okay? But because of the way the spine works, if you're carrying weight out here...
I can imagine, like, we're going to talk about that in the pregnancy coming up next month.
Right. But like in pregnancy, if you're obese, your center of gravity shifts forward, it puts your spine at an abnormal angle, so that in and of itself can hurt, but over time can cause excess wear and tear.
And because we're putting on weight slowly, we don't see the effects.
Right.
Or feel the effects.
Right. It comes on gradually. You're absolutely right.
Buddy, you're amazing. Great information, as always. If you want to find out more information about Dr. Stevenson and his amazing team over there at Optim Neurosurgery, there it all is up on the screen. Give them a call. Great information. See you after this short break.